My name is Dana Dowless. I'm the Research Study and Diet Nurse for the Pediatric Epilepsy Group at Massachusetts General Hospital. I'm going to be reviewing treatments in sunflower syndrome. We'll be reviewing treatments utilizing results from a red cap survey that was given to 68 people living with sunflower syndrome. The survey was created to help better characterize sunflower syndrome and help us to better understand many things, and one of those was therapies and interventions that are used and effective in helping treat sunflower syndrome and the hand-waving episodes that occur. Today we will learn about medication therapies, also known as pharmacotherapies, what therapies are used and what therapies have been found to be most effective. We're also going to learn about behavioral interventions. Non-pharmacological interventions is another way of saying that. What interventions have been tried, what interventions are most effective, and what the barriers are to implementing some of these interventions. Sunflower syndrome is a hard-to-treat epilepsy. It often requires more than one medication to help control hand-waving episodes. Respondents reported trying an average of 1.9 anti-seizure medications, so about 2 medications tried per patient. The highest reported number of anti-seizure medications was 7. Of the 68 respondents, 3 experienced freedom from hand-waving on medication. There is no one-size-fits-all therapy to treat sunflower syndrome. No medication has been found to be effective in all patients. As you can see from this bar graph, there have been many medications tried. Today we're going to be covering 5 of the most effective medications and most frequently used. So levetiracetam, also known as Keppra, lamotrigine, also known as Lamictal, valproic acid, also known as Depakote, ETHOSUXIMIDE, also known as Zarontin, and CLOBAZAM, also known as Onfi. Of the medication therapies tried, valproic acid and nutrition therapy were the only 2 therapies with more than 5 respondents to show benefit in the majority of those who tried them. Valproic acid had 60% of people benefit, and nutritional therapies had 80% of people that tried benefit. You might be wondering why nutritional therapies is lumped in with medications, and that is because nutritional therapies need to be monitored just like a medication. This slide was created by Dr. Elizabeth Teal to show how different medications target different types of epilepsy. There's generalized epilepsy, which involves usually more than one area of the brain and impairs awareness. Focal seizures usually affect one part of the brain and often do not cause changes or alterations in awareness. As you can see, the medications that are used to treat sunflower syndrome fall primarily under the generalized seizures. So the benzodiazepines, ethosuximide, valproic acid, lamotrigine, levetiracetam. The reason is because sunflower syndrome is considered a generalized epilepsy. The first medication that we're going to talk about is Keppra. This medication is generally well tolerated with a smaller amount of side effects and has had some success for people with hand-waving episodes. This medication is also quickly therapeutic, which is really great if you're trying to get started on something fast. The problem with Keppra is that some people experience mood and behavior changes on this medication. You can take vitamin B6 for this, and some people see improvement after that. Also, the mood and behavior changes are not dose dependent, which means that if you don't have behavior changes at 500 milligrams, which is a low dose, you aren't expected to have behavior changes at a higher dose, like 4,000 milligrams. This medication can cause side effects such as dizziness and headache and sleepiness. These are common in many of the seizure medications. The next medication we're going to discuss is lamotrigine, also known as Lamictal. This medication has to be titrated very slowly because it can cause a serious rash that would cause you to stop the medication if it were to occur. So this medication does take a while to become therapeutic. It does have moderate success for hand-waving episodes. Some of the other side effects of this medication include dizziness, upset stomach, and double vision. This can also cause tremors and myoclonus, and there is a possible interaction with valproic acid. Valproic acid, also known as Depakote, had the highest amount of success for hand-waving episodes per our survey. It does come with some loftier risks, though, that need to be considered before starting this medication. Some of the more serious risks include decreased platelets, also known as thrombocytopenia, which can cause bleeding, and it can also affect the liver, also known as hepatotoxicity. This can also cause issues for hair thinning, which, if you're bald, is not a big deal, but if you are young and have a full head of hair, you can take biotin to help with this. It can also cause tiredness and upset stomach, as well as weight gain and sometimes changes in behavior. ETHOSUXIMIDE, also called Zarontin, is the next medication. It is highly effective in absence seizures, which a lot of people know as staring spells. It's been on the market for over 60 years, and it does have some success for hand-waving episodes. It's important to remember when considering these medications that people who have hand-waving episodes can often sometimes have other seizure types as well, like absence seizures. So while ethosuximide may not be as effective at treating hand-waving episodes, it can help with some of those other seizure types like absence. This medication does tend to come with some GI side effects, such as upset stomach, diarrhea, and decreased appetite. Like valproic acid, it can also have some hematologic effects, such as thrombocytopenia. The final medication we're going to discuss is CLOBAZAM, also known as Onfi. This medication has less side effects, but it also had less success with hand-waving episodes. It is effective at controlling other seizure types, just like ethosuximide. It can interact with CBD oil, and some of the side effects that you can expect with it would be drowsiness, dizziness, poor coordination, and restlessness. So an overview again of all these medications. Valproic acid is the most effective per survey, but comes with heavier side effects. Some of the medications that have less side effects include Keppra and Onfi. These were not as effective as valproic acid, but should still be considered because if they are effective for you, they carry less risk. Now we're going to talk about the behavioral interventions that can help reduce hand waving. 88% of respondents reported that behavioral interventions were effective at reducing hand waving episodes, which is great news. Interventions that people tried included wearing hats and sunglasses. This included indoors and outdoors. Trying focused activities when they were in the sun. Having people hold their hands. Avoiding or turning away from the sun or light source. Deep breathing, covering one eye, and using special tinted lenses. 21 out of 68 reported a reduction in hand waving episodes with specific types of glasses or lenses. These different types of lenses included welder's goggles, polarized lenses, blue, yellow, or green tinted lenses, as well as Zeiss tinted glasses. Welder's goggles were reported to be the most effective. Interventions are effective, but they're hard to implement. There are many barriers to using behavioral interventions. We often hear that the draw to light is very strong and people will take off their sunglasses and hats even when they go outside intending to use them. It's inconvenient to use interventions 24/7. It's unrealistic that someone would be able to hold down hands 24/7. It's unrealistic to keep sunglasses on 24 hours of the day. It also can cause feelings of embarrassment. When you're going outside to play with your friends, you don't necessarily want to be wearing welder's goggles when no one else is. It can kind of make you feel isolated. It also can affect vision when in use. The way most of these interventions work is by blocking light sources. And so that can result in things being too dark or being colored funny if you're using tinted lenses. And also wearing hats and trying to keep them down over your eyes can also obstruct view. No intervention has been found to be 100% effective as of yet. So, what does this all mean? There is no one-size-fits-all solution for sunflower syndrome. How everyone approaches treating their hand-waving episodes is different, and that's okay because different things work for different people. The next step in finding effective treatments that can be used more universally is by continuing to investigate the natural history of sunflower syndrome. Why are people drawn to light? Why do the light sources cause these hand-waving episodes? These are important things that we need to figure out in order to help stop them before they start. If you enjoyed this conversation, then some of the other talks that might interest you are the low glycemic index treatment therapy discussion by Kennedy Jeenan, the fenfluramine discussion by Sandeep Patel. This is a medication that is currently being studied, and a discussion about being a clinical trials participant. This is being done by Taylor Savage. I would like to thank Dr. Elizabeth Teal and Patricia Bruno and Kennedy Jeenan for their help with this presentation. These very bright women all also contributed heavily to the REDCap survey paper that is now published as of this week in Epilepsy and Behavior. So you should take a look at that as well if you have time. Thank you, and I hope you enjoyed this presentation.